Thank you for joining us on Journey to 600. Today we're going to be focusing on right versus left hemispheric strokes. So what is a CVA, aka a cardiovascular attack, aka a stroke? This occurs when there is a loss of blood flow to a part of the brain, so then those brain cells cannot get oxygen, they can't get nutrients that they normally get from the blood, so then the cells start to die. There are two types of strokes. There's ischemic stroke. This is when there is a blood clot that blocks a blood vessel in the brain. This makes up about 80% of all strokes. Then there is the hemorrhagic stroke. This is when there is a blood vessel that breaks and bleeds into the brain. There is also TIAs, and this is when the blood supply to the brain is blocked for just short periods of time. This is actually considered a mini stroke, and the damage to the brain isn't permanent, but if you or someone you know has a frequent TIAs, then they are at much higher risk of having a stroke. Okay, let's look at some signs and symptoms you would have with right versus left strokes. So, with the right, you would see somebody who has more visual, perceptual impairments. Their behavior might be impulsive and quick and have poor judgment of the situation and have difficulty self correcting. They also have difficulty with the perception of emotions and difficulty with visual cues. So they do better with very direct commands with their treatment, and they have difficulty sustaining a movement, so maintaining a movement consistently. Versus the left, you'll see more speech and language impairments, and their behavior is more slow and cautious. They also have difficulty expressing their emotions and difficulty with verbal cues and commands, so you would have to use more tactile and visual cues. And they also have difficulty planning movement, so that apraxia is present. Okay, is it really one of my PowerPoints if I don't have a visual? So this one shows much of what I had on the last slide, it says, but I like this visual because it also shows you the side that would be paralyzed. So if you have a right brain damage or right hemispheric stroke, you are going to be paralyzed on the left side, hemiplegic, and vice versa. Okay, the correct answer is D. Let's go over this question. Your patient's chart states that the patient had a stroke that affected their left hemisphere. What are some of the characteristics that you might encounter? So let's go over A. A is slow and cautious behavior. That tracks with left-sided hemispheric strokes, but difficulty with the perception of emotions is more of right-sided. Then we have B. So, right facial loss of pain. I didn't specifically say this one, but it was in my visual, and it is common with left sided brain damage. So, that tracks, but quick and impulsive behavior is more right sided. C is difficulty sustaining a movement, which automatically that is a right sided, so we could go ahead and mark that one off. But visual perceptual impairments are also right sided, so C doesn't even have a left sided symptom. Then we have D. Difficulty expressing emotion and speech impairments are more commonly a left hemispheric stroke. Okay, the correct answer is B. Your patient demonstrates left-sided weakness and quick impulsive behavior during their therapy session. What is their possible diagnosis if you didn't read their chart? So, of course, always read your chart before you see a patient, but if you didn't, these are signs and symptoms of a right hemispheric stroke. So, really take the time to know the difference between a left and a right hemispheric stroke. I mean, obviously, there's certain lobes in the brain, which I'm going to address in a later video, but I think it's important to know the difference so you could really narrow down some of your questions. Like the previous question, you could have marked a lot of those out if you knew what is common with left and versus right side hemispheric stroke. So just kind of knowing those so you can save some time while taking your NPTE. Thanks again for joining us on Journey to 600. Please like, subscribe, and turn on your notifications for future videos.